Top 12 Dangerous Diabetes Nighttime Signs You Must Not Ignore. In the U.S., over 38 million Americans are living with diabetes, and millions more are undiagnosed. What's even more alarming? Many of the early warning signs appear when you're fast asleep. If you're waking up in the middle of the night drenched in sweat, feeling shaky, or needing to rush to the bathroom, it might be more than just a restless night. These symptoms are incredibly common across the country, but they're also commonly ignored, until it's too late. For Americans, where fast food is part of daily life and stress levels are high, nighttime can reveal hidden imbalances in blood sugar, and if left unchecked, these signs can lead to heart disease, nerve damage, or even a diabetic coma. Today we're breaking down the top 12 most dangerous nighttime signs of diabetes, symptoms that are quietly affecting people in every state, from California to New York. Whether you're managing diabetes or just trying to stay healthy, this video could be your wake-up call. Stay informed, protect your health, hit subscribe and turn on notifications to get real, US-focused health tips that can truly make a difference. We release new videos every week because your well-being is worth it. 1. Frequent nighttime urination, nocturia. If you're waking up more than once a night just to go to the bathroom, it could be your body's early warning sign of a serious blood sugar imbalance. While many people associate nighttime urination with aging or drinking water too late, frequent trips to the bathroom can signal something deeper, especially when it becomes a regular pattern. When blood glucose levels rise too high, the kidneys work harder to remove the excess sugar through urine. This leads to increased fluid loss, which explains the constant need to urinate, even while you're supposed to be resting. Interrupted sleep not only causes fatigue, but also prevents your body from completing essential restorative processes. Over time, this symptom can lead to dehydration, poor sleep quality, and strain on kidney function. It's often one of the earliest and most overlooked signs of diabetes or prediabetes. Many people ignore it or assume it's just part of getting older, until more serious complications begin to develop. If you find yourself waking up to urinate nearly every night, especially if it's combined with unquenchable thirst, dry mouth, or fatigue during the day, it's worth paying attention. These may be more than minor annoyances. They could be signs your blood sugar is far from under control. 2. Night sweats. Waking up soaked in sweat, when your room is cool and your blankets aren't too heavy, can be an alarming experience. While occasional night sweats might be linked to stress or hormonal changes, frequent episodes could be a sign your blood sugar is dropping too low while you sleep. This condition, known as nocturnal hypoglycemia, happens when insulin or diabetes medications cause a sharp dip in glucose levels overnight. In response, your body triggers an adrenaline rush to restore balance. That surge in adrenaline causes the body to sweat and often leads to a racing heartbeat or even vivid, disturbing dreams. Many people dismiss night sweats as harmless or chalk them up to anxiety, but if they happen regularly, especially alongside symptoms like shakiness, hunger, or confusion, it could be a red flag that your glucose levels are unstable. This kind of blood sugar fluctuation not only disrupts sleep, but may also contribute to long-term fatigue, mood swings, and cardiovascular stress. If you're waking up drenched in sweat more than once or twice a week, it's not something to ignore. Track your symptoms, consider a blood sugar check during the night, and consult a healthcare provider. Your body may be giving you a vital clue, one that appears only when the lights are out. 3. Sudden nighttime hunger. Waking up in the middle of the night with an intense urge to eat, especially craving sugary or high-carb foods, isn't just about late-night snacking. It could be your body's way of signaling that your blood sugar has dropped too low while you sleep. This condition, known as nocturnal hypoglycemia, occurs when insulin or other glucose-lowering mechanisms overshoot, causing your blood sugar to fall below normal. In response, your brain triggers hunger as a protective measure to bring glucose levels back up. The cravings are usually strong and hard to ignore, pulling you out of deep sleep and disrupting your rest. While occasional nighttime hunger might be harmless, frequent or intense episodes should raise concern. Many people misinterpret this as poor eating habits or stress eating, when in reality, it could be an early warning sign of diabetes or prediabetes. If you often wake up feeling shaky, irritable, or ravenous, especially if it happens despite a regular dinner. It may be time to monitor your blood sugar levels overnight. Keeping a food and symptom journal or using a continuous glucose monitor (CGM) can help identify patterns. Consistently ignoring these signs could lead to poor glucose control and increase your risk of more serious complications over time. Listen to your body. It knows when something's off. 4. Insomnia or restlessness. Struggling to fall asleep or waking up frequently during the night may not just be due to stress or an overactive mind. If it's happening regularly, and especially if it's paired with other subtle symptoms, it could be linked to unstable blood sugar levels. When your glucose fluctuates during the night, either dropping too low or spiking too high, it can trigger your nervous system, making it difficult to relax into deep, restful sleep. Low blood sugar can cause shakiness, irritability, and even a subtle sense of panic, while high blood sugar may lead to dehydration and discomfort, both of which can interfere with sleep quality. People often don't associate sleep disturbances with diabetes, but the connection is real and well documented. Over time, this restless sleep can lead to chronic fatigue, poor concentration during the day, and a weakened immune system, putting your overall health at risk. If you find yourself tossing and turning night after night, despite having a quiet environment and healthy sleep habits, it might be time to explore deeper causes. Pay attention to how you feel before bed and when you wake up. Restlessness combined with thirst, frequent urination, or anxiety may be your body's subtle cry for help. Your nights shouldn't feel like a battle, especially when sleep is supposed to heal you. 5. Tingling or numb feet. That pins and needles sensation in your feet, or the strange feeling that your toes have fallen asleep, might seem minor, but it can be one of the earliest signs of diabetic nerve damage, known as peripheral neuropathy. During the night, when your body is at rest and there's less movement, you may become more aware of these odd sensations. Tingling, numbness, or even burning in the feet can interrupt your sleep or make it hard to fall asleep at all. For people with high blood sugar over time, this nerve damage can start subtly and worsen quietly. What's especially concerning is that many individuals dismiss this as poor circulation or a normal part of aging. But when the nerves are consistently exposed to elevated glucose levels, they begin to deteriorate, leading to permanent damage if left untreated. This nerve issue often starts in the feet and can progress upward, sometimes leading to balance problems or even loss of sensation, making it harder to detect injuries that can later become infected. If you regularly notice tingling or numbness in your feet, especially at night, take it seriously. It's not just discomfort, it could be your body's way of waving a red flag. Early detection and proper glucose control can help slow or even prevent long-term nerve damage. 6. Nighttime leg cramps. Waking up with a sharp, painful cramp in your calf or thigh can be more than just an uncomfortable nuisance. It might be a signal that your blood sugar levels are out of balance. Nighttime leg cramps, especially when they happen frequently, may be linked to poor circulation, nerve irritation, or electrolyte imbalances, all of which can be complications of diabetes. When glucose levels remain elevated over time, it can damage the nerves and blood vessels that supply the muscles in your lower limbs. This damage disrupts normal nerve signals and muscle function, making spasms and cramping more likely. Dehydration caused by high blood sugar or frequent urination can also contribute, as it throws off the balance of essential minerals like potassium and magnesium. Some people may also experience what's known as restless legs, a condition that causes an uncontrollable urge to move the legs, often accompanied by unpleasant sensations, another possible sign of underlying nerve issues. If you're stretching in bed more than you're sleeping and leg cramps keep waking you up, don't ignore the pattern. Track how often it occurs and what symptoms accompany it. Regular cramps at night, especially when paired with tingling or numbness, could be your body's way of hinting at a bigger issue, developing or unmanaged diabetes. 7. Blurred vision in the morning. Waking up and finding your vision is foggy or blurry can be disorienting, but if it's happening often, it might be more than just sleepiness. Morning blurred vision is a common yet under-recognized sign of fluctuating blood sugar levels, particularly in people with undiagnosed or poorly managed diabetes. High blood sugar causes fluid to shift in and out of the eye's lens, temporarily altering its shape and ability to focus. This can result in hazy or distorted vision that typically improves as the day goes on and your blood sugar stabilizes, but it may return night after night if the underlying issue isn't addressed. While many people blame screens or sleep position for morning vision problems, persistent blurriness could be the first sign of diabetic retinopathy, damage to the tiny blood vessels in the retina caused by elevated glucose levels over time. Left untreated, this condition can lead to permanent vision loss. If you regularly notice difficulty seeing clearly in the morning, especially if it's paired with dry eyes, headaches, or sensitivity to light, it's time to take it seriously. Your eyes offer a window into your overall health, and they might be warning you about rising blood sugar levels before any other part of your body does. 8. Waking up exhausted. You went to bed on time, didn't stay up scrolling, and got what should have been a full night's rest, yet you wake up feeling like you haven't slept at all. If this happens regularly, it might not be your mattress or sleep schedule to blame. It could be a hidden sign that your blood sugar levels are interfering with your body's ability to truly rest and recover. When glucose levels are unstable, either too high or too low, your sleep cycles can become fragmented. Your body may spend less time in deep sleep, the most restorative phase, because it's busy trying to correct internal imbalances. These microarousals may not fully wake you, but they prevent you from getting the quality rest your body needs to recharge. Chronic fatigue upon waking is often one of the earliest signs that something is off metabolically. It's especially important to pay attention if this tiredness is accompanied by brain fog, irritability, or a strong craving for sugar in the morning. Sleep should leave you feeling refreshed, not depleted. If you're constantly waking up exhausted despite doing everything right, it may be time to check your blood sugar. Your body might be fighting a hidden battle each night, one that you can't afford to ignore. 9. Mood swings or night terrors. Waking up feeling unusually anxious, emotionally overwhelmed, or even terrified from a vivid nightmare isn't just unsettling. It might be your brain responding to blood sugar imbalances while you sleep. Emotional disturbances at night, such as mood swings, night terrors, or sudden panic upon waking, can be triggered by sharp drops or surges in glucose levels. When blood sugar falls too low during sleep, the brain doesn't receive the steady fuel it needs. This lack of energy can disrupt normal neurological function, sometimes leading to intense emotional reactions, ranging from fear to confusion, anger, or sadness. On the flip side, high blood sugar can also interfere with the brain's chemical balance, affecting how you process stress and regulate mood. People often overlook these emotional red flags or blame them on nightmares, daily stress, or sleep disorders. But when they become recurring, especially alongside other symptoms like night sweats, fatigue, or rapid heartbeat, they may be signaling something more serious, like diabetes or insulin resistance. If you're experiencing repeated emotional disturbances during the night, don't just write them off as weird dreams. Track your mood, sleep patterns, and how you feel upon waking. These invisible battles your mind faces while you sleep could be your body's way of asking for help and balance. 10. Dry mouth and dehydration. Waking up with a parched, sticky mouth or feeling like you need to chug a glass of water before even getting out of bed might seem harmless, but it can be a key indicator that your blood sugar levels are too high overnight. When glucose levels rise above normal, your body works harder to remove the excess sugar through urine. This process draws more water from your tissues, leaving you dehydrated, even if you drank plenty of fluids during the day. As a result, dry mouth becomes a regular part of your mornings, and you may notice other signs like cracked lips, dry tongue, or even a sore throat. Dehydration from high blood sugar doesn't just affect your comfort, it impacts kidney function, heart rate, and overall energy levels. It can also contribute to headaches, dizziness, and brain fog. Worse, chronic dry mouth increases the risk of gum disease and tooth decay, since saliva plays a crucial role in protecting oral health. If you're noticing persistent dryness upon waking, along with increased thirst, frequent urination, or fatigue, your body may be signaling an imbalance that shouldn't be ignored. A simple blood sugar check could reveal a deeper issue and help you restore hydration and balance from the inside out. 11th, rapid heartbeat. While sleeping. Feeling your heart racing in the middle of the night without any clear reason can be unsettling. You're lying still in a quiet room, yet your chest is pounding as if you've just finished a sprint. This isn't just a momentary fluke. It could be your body reacting to a sudden drop or spike in blood sugar levels while you sleep. When blood glucose drops too low during the night, your body releases stress hormones like adrenaline to bring it back up. That hormone surge doesn't just cause night sweats or restlessness. It can also speed up your heart rate and make you feel anxious or even panicked upon waking. Conversely, a rapid heartbeat may also happen if blood sugar spikes, causing dehydration and strain on your cardiovascular system. Either scenario disrupts sleep and places extra stress on the heart over time. People often confuse these nighttime heart palpitations with anxiety or bad dreams. But if they occur frequently, especially alongside symptoms like sweating, shakiness, or confusion, it's worth taking seriously. Don't ignore what your heart is telling you in the stillness of night. A consistently elevated heart rate during sleep may be a red flag that your blood sugar isn't under control, and your heart is paying the price silently. 12. Sleep apnea. Loud snoring, gasping for air, or pauses in breathing while sleeping might seem like nuisances, but they could be symptoms of sleep apnea, a serious condition that's often linked with diabetes. And for many people, it's happening night after night without them even realizing it. Sleep apnea occurs when the airway becomes partially or fully blocked during sleep, causing brief interruptions in breathing. These episodes can happen dozens, or even hundreds, of times per night. Each time your brain wakes you up just enough to restart breathing, it disrupts your natural sleep cycles, leading to poor sleep quality and daytime fatigue. But here's the critical connection. People with type 2 diabetes are significantly more likely to have sleep apnea, and the condition can worsen blood sugar control. The stress these breathing interruptions place on the body increases insulin resistance and inflammation, two key drivers of diabetes complications. If you or your partner notice loud snoring, restless sleep, or daytime drowsiness, it's time to take action. A sleep study can diagnose the problem, and treatments like CPAP therapy can dramatically improve both your sleep and your blood sugar levels. Ignoring sleep apnea doesn't just lead to exhaustion, it increases your risk for heart disease, stroke, and worsening diabetes. Sleep well, live well, because your health depends on both. Diabetes doesn't always shout. It whispers through your body, especially at night when you're least aware. These 12 nighttime signs may seem small, but together, they paint a bigger picture of what's happening inside. And the earlier you listen, the better your chances of staying healthy, strong, and in control. Whether you've experienced one of these symptoms or several, don't ignore them. Your body is wise. It gives subtle warnings long before things spiral. So take them seriously. Keep a symptom journal. Talk to your doctor. Get your blood sugar checked. Prevention starts with awareness. At this channel, we believe health education saves lives. That's why we create videos like this, to help you catch problems early, before they become life-changing diagnoses. If this video opened your eyes, give it a thumbs up to support our mission. Share it with a friend or loved one who might be ignoring these signs. They'll thank you later. And don't forget to subscribe and turn on notifications so you never miss an important health update. We've got more life-saving tips, practical advice, and empowering insights coming your way every week. Stay healthy, stay informed, and most importantly, stay ahead of the signs.